little bit about the happiness procedure, that's male girth enhancement. Then we're going to talk a little bit about some cool circumcisions that we've done this past week. And then maybe a little bit, if we have time, because we'll be taking your questions over on the YouTube Live. So if you have questions, get over to YouTube Live. It's very searchable. After we talk about the happiness procedure, we'll talk about some cool circumcisions, getting a lot of interesting questions about that. We did some great cases this week. And then maybe we'll talk a little bit about erectile function or dysfunction and how that kind of fits into the whole thing. So a lot of very searchable terms this week. So we'll start off with the happiness procedure that we've developed here over the past decade or so. And again, if you have questions, check out YouTube Live. We're going to get those screened, and even if we don't answer the questions today, we can shoot you answers as we go. So just, it's all about the social media interaction stuff. I do the surgery, they do the social media. So YouTube Live today is the place to hit up. So the happiness procedure, because without happiness, you can, well, anyway, no, that's another bad dad joke. The dad jokes are free though, so that's all good. So, when it comes down to happiness, it's all about girth. It's more about girth than about length. We've done the surveys before. We've had many, many hundreds of people respond to the surveys, and some people like both. Some people prefer a little bit of length, but girth seems to be where the majority of people think it's at in terms of stimulation and in terms of a grower being a shower and strutting out into the gym locker room all happy and stuff like that without actually having to have a full erection. So if you're having a hard day, so to speak, that may be a good thing. But we see lots of guys. We talk to guys from all over the country and all over the world about girth enhancement, and about a girth enhancement that can be temporary. They can dip their third toe into the ocean, so to speak, or if they want to have something that's going to last for years and years and years, we have a very long-lasting filler. Literally lasts for years. It's been in these cheeks for over 8 years, and I use more down below in the pickle than I used in both these cheeks together 8 years ago when I saw the B-roll of TV that I was being interviewed on. So the happiness procedure is something that can be done in most guys who have normal anatomy, that don't have an active STD or anything like that. And we can increase the girth from the base of the shaft up to the circumcision scar or the foreskin where it attaches, and then taper it towards the tip by between 1/2 inch and 1.5 inches per session. The sessions need to be about 6 months apart in order to minimize the risk of inflammatory response and forming nodules or asymmetries or things like that. But in that range, we get good girth enhancement that stays symmetric and stays useful. The temporary fillers are ones that are FDA approved for use on the face, and they last about a year. Companies would like us to think it's longer, but the reality is down below. Clinically useful girth enhancement for about a year. And for guys who are on the smaller stature, that's a pretty good one to start off with. For guys who are more of our basketball player types, who are long and thin, so to speak, and those are guys that we can put in something that's going to be a little bit more firm and is actually a biostimulator. So the biostimulators work both by volume and by stimulating your own collagen and elastin production for a while or for years. So it depends on which biostimulator we use, and of course how much. And we've learned over the years that too much is too much. It puts you more at risk for having nodules and bubbles that you can feel and things like that. And when people come in and say, "Doc, I'd like to be ribbed for her pleasure, can you put in some speed bumps?" And I can't dependably do that. So some people form clumps of material, especially if you put in too much at a time, and others do not. So we want to keep it simple, dependable, trouble-free, worry-free. I like sleeping at night. So we put in enough to get a very nice improvement in girth. And then if you want more, we found if you wait a while, 6 months or so, you can put in more, and you can mix and match the fillers. If you know how to have them play in the same sandbox, that works out pretty well. So that's a little bit about the happiness procedure, done here in the office, 5,300 square foot of fun. AAAHC nationally accredited operating room, so we do procedures from nose to toes or forehead to feet or sole to sole, depending on your orientation. But I enjoy doing a lot of different procedures here. We have lots of different parts of the electromagnetic spectrum, so lasers, light, intense pulse light, radio frequency, electromagnetism, and of course ultrasound. So all different parts of the electromagnetic spectrum that we utilize in our procedures, as well as surgical procedures. So laser assisted upper and lower blepharoplasties, browpexies, facelifts, neck lifts. Gynecomastia is a big one. I'm using the laser now to take out that glandular material through a fine incision just inside the nipple areolar complex, as well as liposculpting the chest so that when you see that pectoralis definition, you can really have something that looks good in a t-shirt or without a t-shirt, whereas before it looked a bit nipply. And then ab sculpting, high def, lipo, and things like that. The fat, very interestingly enough, is higher in rejuvenative cells, stem cells, if we want to call them that, but let's call them rejuvenative cells for now, is higher in rejuvenative cells than bone marrow. So that fat can be turned into microfat and nanofat, which is chock full of rejuvenative cells, and selectively used to treat other things. So we're looking at IV deployments, but that's a whole different area, and we want to make sure that we're compliant with all the federal regulations, same day, autologous, homologous, all that kind of stuff. But we're set up to do that now as well. So I'll be attending some cool conferences this year, Cell Surgical Network and SStarts and things like that, and getting fully up to speed, as well as sharing what our research has demonstrated with those rejuvenative cells. So that's kind of a cool thing that's up and coming. I've been one of the moderators for the rejuvenative rejuvenative medicine sessions at the American Academy of Cosmetic Surgery for the past couple of years, and we are getting to the point where there's some cool implications. So that's going to be part of our rejuvenation below the belt as well as above the belt. So that's a little bit, anyway, about, and kind of went off track there, but about the happiness procedure, because you can do it with fat as well. You can use fat to increase girth as well, and we see improvements in erections and sensation and things like that. Of course, we're using our own high-density platelet-rich plasma prepared here on site. We can actually measure the number of platelets and things like that, and that improves the outcome as well, and the duration of action of the fat cells, because you don't generally make too many fat cells as you get older. You may make fat cells. Fat cell probably lasts a good 10 years before it has to be replaced. And when you're moving the nanofat over to wherever you're putting it, you include preadipocytes and mesenchymal stem cells and things that will turn into fat, but they can also help selectively grow blood vessels in the hydraulics and nerves in to improve sensation along the way, both for men and for women. So if you're traveling down to Virginia, as they say, and without getting a fluffy muffy, you want to transfer some material below the belt for rejuvenative purposes. When things get a little floppy and flaccid, you can perk them up, shrink them down without ever having to do an incision between the labia like we used to do years ago, in order to reduce those areas and make them more aesthetically appealing and functional. So anyway, happiness procedures and O shots and P shots and things like that. Any emergency questions we need, or should we transition into circumcisions?
Let's go into circumcisions, Doc.
Moving into circumcisions, or due to circumcisions beyond our control. In this case, circumcisions were within our control, and we've had a couple of really interesting cases lately. We had a buried penis, which was a gentleman who's a truck driver who's truly had a buried penis. There was an opening and nothing visible, and we were able to very carefully use the CO2 laser to atraumatically sculpt that tip out and bring it to the surface, so that he was able to see the tip of the penis. The shaft of the penis in these cases gets denuded, and once he's finished losing weight, they'll be able to reduce the pannus, swing some of the skin around the shaft, so he'll have a a skin graft, if you will, for the shaft to be functional, because the penis works. It's just buried, except now the tip at least shows so that he can pass urine and such things and not have to worry about stretching openings so that he can even pee while he's driving, or in between, I guess, when he pulls over. So that was kind of cool, but we had a neat variation where it turns out in the Philippines that they don't do a standard circumcision. And, many nations of the world, circumcision is not required for entry, so to speak. And, but for both hygiene sometimes and religious reasons and things like that, a circumcision where the foreskin is removed at birth occurs. And one of the things that can happen is they can take too much or too little. So you have a turtleneck, a mock turtleneck, or a t-shirt. It just depends on how much extra skin they take off. But if they take too much extra skin, then you have a problem with the pickle extending to full length when it's erect. Or if they leave too much and it adheres to the tip, that's called the glans, then the part of the proximal part of the glans and the corona, the edge of the glans and everything down below that, if it tacks down and heals like that, what you have basically is a submerged pickle that isn't able to go to full erectile capability. So we not only don't get to Mars, we don't get to orbit. And so that we have to free that up. And we're able to do that under twilight sedation with local anesthetic and very carefully use the CO2 laser to release those tissues until the whole tip of the acorn, the whole glans is exposed, and then the corona, the edge, has to be exposed, and that's usually submerged in some scar tissue, because the glands that line the inside of the foreskin, that reflection of mucosal tissue, continue to produce oil and desquamate, and the inside of the foreskin, or what would be the foreskin if it was not matted down, produces epithelial cells, and so you get a whole collection of non-traditional biologic material, but either way it causes everything to mat down and kind of scar down, and so it has to be carefully released and sculpted until you have something that looks like a pickle again, and then that extra skin has to be released and allowed to move down the shaft, maybe trimmed up a little bit so that you can get what looks like a more traditionally circumcised penis. And that's kind of a cool thing. So we go from something that looks like a bulge to something that truly looks like a pickle with a visible tip, and that will re-epithelialize and get normal sensation again over time and be something that's both more functional and prettier to look at as well. So that's kind of a neat thing. Adult circumcisions can be a bit tricky because some people like the high and tight, where they like the skin of the pickle to go right up to the corona, and some people like to leave a little bit and make sure that there's room to grow, so to speak. So those are all things that we talk about when we do those consultations about circumcisions. And we only do adults. Below that age, that's a person's preference as far as what they want to do. And we've run surveys on those, and I don't feel pro or con about that. A pickle does not have to be circumcised. Foreskins, as long as there's good hygiene, work great. They should be able to pull back all the way and replace. But when there is an erect pickle, that foreskin needs to be able to pull back all the way without discomfort. And it does serve a purpose in that when the foreskin is in place, it prevents the tip of the pickle from getting a lot of stimulation, so that when it pulls back with an erection, it gets a great deal of stimulation by comparison. Now, we did run a survey where we asked if you've had the foreskin removed, did it seem to interfere with relations or decrease the amount of stimulation? It did not, interestingly enough. The body upregulates or downregulates the amount of stimulation that's produced there. So, but it is an area that gets a lot of nerve endings that are available, so to speak. So that's kind of cool. So that's a little bit about circumcision. Oh, the recovery, yeah, we had some questions on recovery. Takes about a month for re-epithelialization to occur, and although they are absorbable stitches, I do generally take them out once enough healing and reepithelialization has occurred, it's usually between 2 and 3 weeks. Teeny tiny stitches about as fine as your eyebrow, so they're put in under magnification with good lighting, with halogen or LED lighting. And so it's a surgery procedure. It takes between 1 and 2 hours to do. It's not super quick, but it's worth the investment in time to get something that looks more like more statuesque, more chiseled, shall we say, and functions as well. So it has to be pretty, it has to be symmetric, it has to work. So those are all interesting things. So we've talked a little bit about the hat penis procedure, a little bit about girth, a little bit about girth enhancement, and a little bit about circumcisions. Do we have some time to talk about erectile function? Okay.
Let's do erectile function, and then let's touch on the P shot as well.
Okay, yeah, that's part of treatment of erectile function, so that works well. So, erectile function is interesting in that it has to be an intimate dance between the parasympathetic nervous system and the sympathetic nervous system. Now, both those nervous systems start in the brain, come down the spinal cord, and if you've had a spinal injury, one may be injured more than the other, because the nerve roots come out and there's combinations of both the sympathetic and parasympathetic nervous system that feed to the pickle and allow for, in the case of forming an erection, coming to attention, that requires the parasympathetic nervous system. The parasympathetic nervous system is what lets you relax and enjoy life, and it's active when you're in REM sleep. It allows healing, and it allows the pickle to fill with blood. And other things that allow the pickle to fill with blood, you have to have an adequate testosterone level. So testosterone is required for sensation, for erection, for eventually in combination with the sympathetic nervous system, for the splash that happens after erection, at least some of the time, and then everything kind of relaxes because the sympathetic nervous system kills erections. Think about what the sympathetic nervous system does when you're going to war, when you're in fight or flight mode. The sympathetic nervous system is triggering rapidly. It's energizing the blood supply to your muscles, not to your third leg. It's sending blood supply to your brain so that you know how to fight or flight. And so that has very little to do with the other F that's going on when the parasympathetic nervous system is causing erection in that central area, shall we say. Now, the hydraulics have to work. There are 3 hydraulic tubes that are inside the pickle that cause an erection. There's 2 of them, one at about 10 o'clock and one at about 2 o'clock. And they are constantly going up and down and inflating and deflating during the course of the day, many, many, many times. Most guys aren't aware of it, and it's not something they can necessarily control with the head on top of their shoulders. The head on top of the shoulders does have an effect on the head below the belt, but it's not always something they can control. So there can be erections that happen just because they happen. The parasympathetic nervous system kicks in, and the corpora cavernosa at 10 o'clock and 2 o'clock inflate, or partially inflate. It could just be a chubby, it may not be a full woody. And then the corpora spongiosum that runs on the underside of the shaft that carries the tube from the bladder all the way out the opening called the meatus, the tip, that doesn't get quite as hard, but it gets firm too. And that tip is part of that vascular space. It's part of the corpora spongiosum. And, we do have guys coming in and saying, well, doc, I've got girth in the shaft, but now the tip seems a little out of proportion. And I can tell you after 20 years of looking at all the variations, there's every variation, guys. As long as it works, it's okay. The tip is part of the vascular space that is the corpora spongiosum. And we don't want to have an intravascular occlusion, an intravascular accident. So I generally don't inject the tip. And you can inject it under ultrasound, or if you know your anatomy real well, there's ways to do that, but that's something that we have a proprietary way of doing. So if someone tells you they're injecting the tip, be very, very wary, because if you get a slough of tissue or you kill a nerve ending or something like that, well, you're stuck, you're done. That race is over, because it's not something that's easy to reverse, so first be careful. Anyway, so parasympathetic nervous system kicks in, and you get a flood of blood to the hydraulics. Now, other things that help hydraulics fill with blood are the 5-phosphodiesterase inhibitor medications. So you've heard of the tadalafils and sildenafils and Viagras and Cialis and all the others. They were actually developed to treat pulmonary hypertension. So they were developed to open up the blood vessels and decrease hypertension in the lungs. A side effect, a very happy side effect, and one that the drug companies took advantage of, is they said, pulmonary hypertension isn't really much of a moneymaker, but inflated pickles are. So they changed their course of direction, and they got all their patents in a row, and so those medications, which are now primarily off patent, quite frankly, are used to open the blood vessels to fill the hydraulics when the parasympathetic nervous system allows those gates to open. And then that part of the parasympathetic nervous system, the next one is it clamps the outflow tract closed so that the corpora cavernosa and corpora spongiosum stay engorged. And so that's what causes an erection and keeps an erection. So you have to have both aspects going. Other things that help with keeping that erection or causing that erection are nitric oxide. So when we talk about nitric oxide in the diet, nitric oxide supplements, things like that, things that are nitric oxide producers or supplements that cause production of nitric oxide, those can help with erections as well. Another thing that helps open up the pipelines are, interestingly enough, the neurotransmitters. So this things like botulinum toxin that we use to treat crow's feet and frowns and wrinkles in the forehead. Those same chemicals are used to relax the smooth muscle so that in people who have hyperhidrosis, they don't sweat as much. And when it's injected into the corpora cavernosa, the smooth muscle that allows the blood vessels to open and feed the corpora cavernosa work better. So we actually use those kinds of medications. So we call it pickle tox, and we're able to inject those. It feels like a little bit of pressure. I do my own. It's not hard to do. Well, I guess it's hard if you don't know the anatomy, but it gets it hard even when it works. So that's all good. So pickle tox, along with your medications, along with a good amount of sleep and diet and exercise and all those things all help in the presence of optimized testosterone to have good erections. What else? P shots. So you may have heard about platelet-rich plasma. And platelet-rich plasma, when you have an injury and the blood circulating through your body goes, there's an injury. And the plasma contains the platelets that come together and cross-link and isolate that injury. They invite the white cells in to take away the injured tissue, and then all the healing factors that grow in new blood vessels, that grow in new nerve endings, are part of the plasma. So if you take a quarter or a third of a unit of blood, like you would donate at the Red Cross, you can spin that down in a clinical centrifuge, and you can separate the red blood cells, which are a little under half the volume generally, about half the volume, from the plasma. Now that plasma is double concentrated. The concentration of platelets, which are easy to measure, in that plasma is about twice of what it was. Well, that's interesting, but it's not a big deal. But if you take that plasma and you spin that down in a clinical centrifuge, now you get plasma that's a minimum of 4 times concentrated. And when you do things in a centrifuge, not a test tube, the bottom part of that plasma milieu is more dense. And now you have platelet-rich plasma at the bottom of that plasma that's been spun now twice, and the top is platelet poor plasma relatively. And so if you take the bottom few cc's, you can use that as a very rich conducting material that contains not only 5 to 7 times more platelets than the regular plasma in your bloodstream, but it also contains more of the healing factors, more of the things that make blood vessels grow in, more of the things that make nerve endings grow in. So if you put that into the corpora cavernosa, or the analogous structure on a woman, you can have better functioning of the corpora cavernosa, and you can have nerve ingrowth. So that cooperates with the parasympathetic nervous system and all the other things to create a stronger, longer lasting erect pickle. At some point, the sympathetic nervous system kicks in. When the sympathetic nervous system kicks in, it allows for orgasm and ejaculation. And once the parasympathetic nervous system kicks in, that's a pickle erectile killer. And so the parasympathetic nervous system kicks in, the pickle goes down, there's a refractory period, which can be minutes, hours, or days, depending on the individual and all the other things, and the whole cycle starts over again. So when we're treating guys, we take a very careful history, as well as doing a physical exam, about what's going on, why is it going on, are we getting erections, are we maintaining them, are we able to achieve orgasm? All those are things that people want to know. Yes, I know all of you in YouTube out there want to know, so YouTube Live, just keep sending the questions in. My staff is writing them all down and trying to prioritize for you, but they'll generally get back to you, or someone else will ask a similar question. Plus, we've done a gazillion other social media oriented educational things. So go to our podcast, Aesthetic Revolution, the podcast. We have lots and lots of TikToks, 2.4-ish million followers there. And yeah, we're pretty much all over social media. The X is taking off nicely. Thank you very much, Elon. We appreciate your help with that. So yeah, lots of stuff on that. So we probably have time for a couple of questions coming up.
We've got a lot of questions coming up about vasectomies as well.
Vasectomies, so I've been doing vasectomies since 1983, and we have no hitters, so to speak. So if you want to think about having a vasectomy that's reversible, don't come to me. Vasectomies generally, so to speak, you get what you pay for. So if you go to, some people, you get a vasectomy that's done with a scant amount of local anesthetic, and the horror stories there about feeling everything and having swelling and yada, yada, yada. Yeah, those are out there, those exist. But when we do a vasectomy here at Aesthetic Revolution, we first want to confirm that the person has had all the reproductive capacity that they want to in their lifetime. Okay. Once they're in agreement, hopefully their spouse is in agreement, then we can talk about, if we do the vasectomy, you're done. At least by standard means. You can sample the testicle, you can grow sperm up in a plate, and you can do in vitro fertilization if you want to. But the fun of actually placing the sample is not what it used to be. So sperm take up a very small amount of the volume of semen, by the way. And so there's actually very little change in the volume or the chemical consistency or the palatability, if you will, of semen after a vasectomy. That is not a way you can tell someone's had a vasectomy. When we do a vasectomy, we do ask you to manscape, don't shave. We don't want the micro scratches in the tissue. So we ask you to shave, to shave a few days ahead of time, or to manscape very gently. And we will generally give you some medication for relaxation, and even have a pain pill on board. You eat normally and drink normally, and when you come to the office, you'll need someone to drive you to and pick you up when we're done. And then we get you into the operating room, and we may give you another injection of happy juice or some laughing gas to relax, or whatever it takes. And a very strong topical anesthetic has been applied to the midline of the scrotum. And in that midline, if your anatomy is like many men, you can actually swing the spermatic cord up, and you can feel that firm cord inside the conduit, and that's the vas. And that's the cord we're going to want to take a piece out of, seal both ends, tie both ends, put one end back inside the conduit, leave the other end outside the conduit, and sew the conduit shut. And that's the way I do a vasectomy, usually through a single insertion, occasionally through a double, just depends on how things are hanging. And then once that is done, very comfortably, because it's all done with a nice block. So we run a blue light special on numbing medicine, so we're able to apply topical numbing so that you don't feel the actual numbing go in. The cord just feels a little distension. It shouldn't feel like you've been kicked in the gut or anything like that. And then we do the procedure. It doesn't take too long once guys are relaxed, so the relaxation is really the rate limiting step. Doing the procedure itself probably takes 5 to 10 minutes aside if things are hanging well that day. Then minimal bleeding, a little bit of support, and a Ziploc with some ice chips, and you can be on your way. Take it easy for a few days, no lifting heavier than a gallon of milk, and no major gym for about a week. After 15 ejaculations, or 6 weeks, whichever is longer, you need to do a post-vasectomy semen-analysis. So we need to make sure there's no swimmers in there, there's no viable swimmers. You are not released to taxi unencumbered or without a raincoat until you prove that you are good to go. Otherwise, things could happen. Like I said, been doing these since 1983. We're very educative about how we do it, very demanding about how we have people follow up. And so far, we've pitched a no-hitter. We have no paternity suits out there, and I don't want any. So if you want to have a vasectomy and don't want to produce more kids, reasonable place to go. But if you think you might want to produce more kids, go get it done somewhere else where they use a clip or a valve or something that might be reversible. Remember that the tiny pinhole in this huge tube, when you put those tubes back together to reverse a vasectomy, the pinholes have to line up, and you may or may not have good success with that. So go to a center where they do that and have a lot of experience if you want to reverse a vasectomy, especially one of mine. Okay, so I think that we've had a pretty good live at 5 this week. We've answered a lot of questions. I can see a lot of questions are coming in. What does this mean?
Next week.
Next week, live at 5,
Oh,
every Wednesday.
Yeah, so next week, again, we'll be live at 5.
Every Wednesday.
And we'll do that most weeks. Occasionally I'll be at a meeting or teaching or something, or my wife will drag me away and make me take a vacation. That's a wonderful thing, because she's a wonderful human being who I adore. But anyway, live at 5. Be there, check it out on all the different social media, especially YouTube Live, and send your questions in. We'll use those questions to do the next lives, and thanks for joining us.